Today's Cardinal lesson is about your Part D drug plan under Medicare and what you need to do about it during this open enrollment time during the year. So if you're on Medicare and you're over here and you have a Medicare Advantage plan, I'm talking about something like United Healthcare or Humana or Aetna or one of these companies, your drug plan is already included in your Medicare Advantage plan. So it's a little hard to review just that because you couldn't change it without changing the whole thing. But you do need to review it and see how it's working for you. What we're specifically talking about is people that are on original Medicare, Part A and Part B. They have a Medicare supplement or some group insurance, and they purchase a separate Part D drug plan, and you need to review this every year. And if you're not on one, we need to have a little talk about the penalty, because the penalties for not having Part D coverage and going without it for a period of time is the penalties last for a whole lifetime. So if you're not on one of these and you're over 65 and you're on Medicare, you might want to just look into getting one so you can minimize that penalty. Now, if you want to look into this thing, we need you to gather a list of all your drugs, the dosages you're taking, how many times you take them a day, and a list of your preferred pharmacy or where you want to go buy your drugs. And if you don't have a preference, we need to know that too. It might be that you just are going to go get them wherever you can get the best deal. We need to know that. I mean, over here, the cost of these things comes in many parts. I mean, at first it's going to come in the premiums that you're going to pay, and then it's the out-of-pocket or the co-payments that you're paying each time you get your drugs filled. So, and the cost is going to vary by where you live, the pharmacy you use, the drugs you're on, and the company that you get the plan from. So, and the biggest driver of this is the drugs that you're taking. And we have a lot of folks who want to be on the same plan as their husband and wife or brother and sister or neighbor. I want the same plan that Sally has. And that just isn't practical when they're taking different drugs. I mean, we have a lot of couples and they'll complain about this afterward. Why don't I have a plan like Mary's or whatever? I'd like to. Well, the reality is Mary's on the plan that's best for her. You're on the plan that's best for you based upon your drugs. But if you see a lot of variances in that, that'd be another reason to just go in and bring this list. And you need to get with a broker. We are brokers, and so we're running this thing. We work in 50 states in the District of Columbia, so we can serve people all over the United States. And we represent most of these plans. And the key is they're not standardized like Medicare supplements. I mean, it's easy to compare Medicare supplements. These plans are not standardized, so it's like comparing apples and oranges and how they're going to play out in the next year. So the overall emphasis that we want to make on this whole thing is you need to redo your drug plan. You need to look into redoing it. Possibly you'll be just fine staying year after year after year with the same drug plan. What I'm saying is it's a good idea during this open enrollment time when you're making changes to at least look into changing it. And the donut hole, which is the first place everyone goes when they're talking about it, this is so confusing to people, and it's just kind of a little nuts of coming up with this as a description, like what is the donut hole? We're not going to let that dominate our training this year and years going forward, because the donut hole, it's actually going to be closed in 2020. I mean, it's closing during 2019. So we got one more year of it, and not worth worrying about too much, and it will be included in all the comparisons. So, we're Cardinal Advisors. I'm Hans Scheil. I've written a couple of best-selling books on talking about Medicare as a piece of retirement planning. You can get those at our website, cardinalguide.com. I thank you very much for listening.